we tend to forget about other issues, other medical issues, psychiatric issues, and addiction issues.
Not enough access to mental health and medical follow-up have been key factors leading to an increase in fatal overdoses over the summer. According to drug addiction professionals here in Montreal, overdose deaths are seeing an increase, with 23 in the month of July alone, the highest number the city has recorded for a single month.
It's actually more difficult for people to basically have access to their healthcare professional in terms of follow-up for their addiction problems, for their medical problems, as well for mental health reasons.
Cities like Vancouver and Toronto have reported an increase in overdose deaths over the past 4 months. In Montreal, 29 overdose deaths have been recorded. One addiction resource center says people are facing even more isolation and more red tape getting help.
And unfortunately, a lot of the therapy centers had to close their admission or reduce a lot. And so that ended up with people wanting to get help but not being able to get the help, having us to tell them, we're sorry, you're going to have to wait.
Even safe injection sites haven't been immune. More workers have had to save someone's life by administering opioid antidote naloxone to someone having an overdose in their center. Public Health says they are still studying the data linked to fatal overdoses, but say most of the drugs consumed were cocaine, amphetamines, crack, and GHB. But one thing that is improving, remote access to medical help.
We've actually made tremendous improvements in terms of telemedicine over the past 3 or 4 months. There are actually ways that people can actually be on contact with each other, and that it actually includes contact with healthcare professionals.
August 31st marks Overdose Awareness Day. Amid the pandemic, health professionals hope the government increases access to addiction help. They also say checking up on family and friends can make a world of difference.
Reaching out to the people we know, our friends and family, and all of the people who actually might feel isolated, especially if we know that some of them might actually be going through some difficult times in terms of being isolated.
In Montreal, Sharon Yonan-Reynolds, City News.